Hello, everyone, and welcome back to another episode of my YouTube channel and podcast, P3 Ministry with Dr. Judy. I am an internal medicine physician. I'm a Christian physician. And in this channel, we discuss all things faith and holistic wellness. I believe that wellness is holistic and should consist of physical, mental, and spiritual health. All three are equally important. Today's guest, I'm very excited to have with me on the podcast today, Dr. Quinton Cancel, who's a urologist, and he will be sharing about men's health. And this is the first time that I've had someone on my platform to talk about men's health. So I'm going to be learning, and I'm sure you're going to be learning. So make sure that you have a notepad and notes. I know that most of the people that do listen are probably female. So whether you're a female, and this is applicable to someone in your life, or whether you're a male that's watching, we're so glad that you've tuned in today. You're in for a special treat. So let me just introduce Dr. Cancel's bio, and then we'll get right into the interview. So Dr. Quinton Cancel, aka Dr. Q, is a board-certified urologist practicing general urology with an emphasis in robotic surgery and men's sexual health and wellness. He obtained his undergraduate degree majoring in biology at Washington University in St. Louis, Missouri. Dr. Q completed medical school and residency at Duke University Medical Center, and he later spent 12 years as a partner in private practice in Tennessee, where he was the chairman of the robotic surgery program. Dr. Q then joined Mission Urology in Asheville, North Carolina. In 2020, where he served 3 hospitals in Western North Carolina. Recently, he transitioned from full-time urology practice to locums, traveling to different hospitals to cover their emergency urologic needs. He also began various entrepreneurial interests outside of traditional medicine, including creating a male enhancement supplement and developed a novel coaching program for men that addresses the mind, body, and spirit called the Woodsman Group. He also has a podcast entitled The Healthy Swag Podcast, where he, along with Dr. Columbus Batiste and Isaac Palmer, discuss health issues concerning Black men. He is married to the former Christia Lamb, and they have 2 boys, Quinton, second, and Jackson. Welcome to the podcast.
Thank you. Thank you for having me, man. I feel like I'm going where no man has gone before right now. So I feel pretty good. Thank you for having me.
That's so funny. No, yeah, it's super important. As I was thinking on preparing for this, I remember I used to do primary care. For most of my career, I've done hospital work, but I used to do primary care. And I just remember it felt like a lot of times men didn't like going to the doctor. And then they did go, it was at the insistence of their wives. Like they could be having serious chest pain and symptoms, but there was a resistance to go. With the one exception, when things weren't working down there in the bedroom, next day, best believe they're making an appointment. No hesitation.
An emergency.
It's an emergency. It's like, I need an appointment stat.
Right. No, you're right. It's still the same. I mean, men, we generally don't like to go to the doctor. We don't trust them. You know, we feel like being vulnerable is not safe, and we don't want anyone to know we're suffering, we're struggling. And so oftentimes we wait till the wheels fall off before we actually seek medical help. And, you know, hopefully conversations like today will make men's health issues front and center, make it less of a taboo, particularly when we're talking about sexual health, but health in general, you know, being proactive and making sure, because honestly, this is the only body you got, you know,
right?
We got one life to live on this earth, and we want to make the most of it. So that's what I'm about. Thank you for bringing me on. I echo what you're talking about as far as holistic health, mind, body, and spirit. You know, we can't really partition ourselves, and one thing is going wrong, it affects the others. So I like your approach, and I share that approach.
Yeah, they're all equally important. You used to live in this area. I'm in Durham, North Carolina. You trained at Duke. So I was like, all right.
Emmanuel
some commonality. Huh?
You're at Emmanuel Temple. Is that where you are? Yes,
that church. Yeah. And you used to attend there, right?
Yeah.
Yeah.
Have fond memories there. Yeah.
It's a small world.
Yes. Shout out to everybody, the Emmanuel Temple family.
I know, right?
We'll be out there in November, actually.
Oh, November.
early
Okay,
November.
that's right around the corner.
Yep. So hopefully we'll
Nice.
be able to worship with you.
Yes. They're doing some health and wellness things too. So I wanted to begin by talking about prostate cancer because that seems to be something that several of my followers and people that are in my audience, their partners, their husbands are dealing with. So can you share about prostate cancer screening guidelines and recommendations?
Sure. Well, prostate cancer, a lot of people don't even know what the prostate is or what its function is. And so just for some basics, your prostate is an organ that sits right below your bladder that your urethra runs through to eliminate urine. Also, semen runs through when you ejaculate. And so as we get older, we start to develop prostate problems. Some are benign and some are cancerous. And so when we get older, typically in our 60s, we start to develop problems with increase in size, which is called BPH. And that is manifested by difficulty in urinating and frequency, going often, urgency, getting up at night, incomplete bladder emptying. These are all benign signs of enlargement. Those are not signs of prostate cancer. And so a lot of times men wait till they can't pee to come get checked out. They kind of let, things sort of be when they notice their stream is decreased and it's taking them a little longer to go. It's like, it's okay. I'm still getting out. They ignore it until, it's too late. And so definitely if you're experiencing any urinary symptoms like getting up at least twice at night when you are experiencing a lot of urgency and frequency, incomplete bladder emptying, like I mentioned, these are signs of BPH. Get checked because there are medications, but there are also some natural things you can do to improve your prostate health. Now, when it comes to prostate cancer, it's been reported that, nearly 1 in 6, 1 in 8 men will develop prostate cancer in their lifetime. Usually over 30,000 men will die from prostate cancer a year, and over 200,000 will be diagnosed. And, why this is important for us, particularly as Black men, is that we have the highest rates of prostate cancer in the country, in the world, really, African-American men. And white men have the second highest rate in the world. But we're 6 times more likely to die from prostate cancer. We're 6 times less likely to be offered aggressive treatment for prostate cancer. So it's really important for us to take our prostate health in our own hands and really be knowledgeable about screening and what to look for. And so when we talk about prostate cancer screening, we're talking about basically 2 tests. One is a PSA that stands for prostate specific antigen. It's a blood test, very simple. And your doctor will evaluate that number. And if it is very high or if it has gone up fast from one year to the next, those are concerning numbers and it will warrant further investigation. If you also have a prostate exam, which is called a DRE, digital rectal exam, where we examine the prostate through the rectum, God put it there, right there, accessible, so we can feel lumps or bumps, hard places on the prostate. That's what we're looking for. And if we find anything like that, that's also a reason to investigate further. And so men, usually I recommend that men, particularly if you're at high risk, if you're an African American, if you have a first degree relative, either a father or brother with prostate cancer, get checked early. Get checked in your 40s, 40 to 45. Just get an initial check just to see where you are. The number is fine. You can actually wait a couple years to get it checked again. Definitely in your 50s for Black men, every year I would check it. The guidelines say around 55 for all men, but again, Black men are at higher risk of dying. So I would lower that a little bit for Black men. And so once you get checked, if there's something wrong, then the only way to diagnose prostate cancer is with a biopsy of the prostate. And that is, it's an office procedure. It takes about 5 minutes. We do it under local anesthetic. So we do numb up the prostate first. There's an ultrasound probe that's inserted into the rectum so we can visualize the prostate. And then we numb up the prostate on both sides and then take 6 little needle biopsies on each side and send that off to the pathologist. And we find out about in a week what the results are. And if it shows cancer, then your doctor will have a conversation based on the volume of disease and the grade of disease, because not all prostate cancer is equal. Okay. Just because you have prostate cancer doesn't necessarily mean you need treatment for it. There is a strategy called active surveillance where we just watch and check every 6 months your PSA and a rectal exam to see if there's any changes. And that's for low grade prostate cancer. So a Gleason 6 is what that's called.
I know people on that strategy.
I'm sorry?
I know people that are on that strategy. I was just going to ask you about that.
For the right patient, it is absolutely the right strategy. For someone who has low grade, low volume disease, so you say you've got one biopsy has 5% of, low grade prostate cancer, you definitely don't need to treat that. That is something that's not going to kill you, something that's not going to spread or metastasize. That's just something you can watch and live with, actually. Now, there are different grades. There's intermediate and there's high grade prostate cancer. And based on what your path report shows, your physician, your urologist will recommend a particular treatment, a definitive treatment. And there are two main categories of treatment for prostate cancer. There's surgery, and the other category is radiation. Now, those are the two kind of main categories. There are subcategories in particularly in radiation, but surgery is mostly done robotically these days.
Okay. Is prostate cancer considered one of a slower growing cancer?
In general, it is. It's not like pancreatic cancer or colon cancer, but if it's high grade, meaning it's like a Gleason 8 to 10, that means it's more aggressive and it can progress fast and get out of the prostate, the capsule of the prostate. And that's the whole goal, to treat the prostate before it gets out of the capsule. So if you think about the prostate like an orange, the capsule is the peel of the orange. And so you want it to be contained within the peel.
Okay, gotcha. That's good to know. So PSA and digital rectal exam starting around age 40 in the 40s, particularly for Black men.
Correct. Yes. Man, I've seen a guy as young as 38 with prostate. That's very rare. Actually, I just treated a man this year who was 36, but he had a very high family, rate of cancer. Like every man in his family had prostate cancer. So when his PSA was up, you had to really pay attention to that. So if you're at high risk like that, like every man in your family has prostate cancer, you may want to consider even before 40 getting a check.
Does BPH increase the risk for developing prostate cancer?
No, there is actually no association. Correlation between size and cancer. And most prostate symptoms don't come from prostate cancer, it comes from BPH. So if you are symptomatic, it's probably means you have a benign condition. Prostate cancer is not symptomatic until it is advanced, like really spread.
Okay, that's good to know. Yeah, because people always, I find, are worried about cancer. No matter what organ they're dealing with problems with, cancer is like one of the things that is like, oh my goodness, do I have cancer? And so you have to sometimes like just reassure them that they don't. So what about testosterone? Because there's been a lot of chatter about that, especially in the holistic wellness space. So everybody needs to get their testosterone checked and it should be like this level, like, so what's the number for testosterone and when should men consider getting that checked? Because like some of the holistic wellness people, I don't know if there's evidence behind it. That's why I'm asking. Okay. They say that, your testosterone should be like at a certain level. I don't know if it's like 500, 400, like above whatever the normal limit is. It's what they say. And there seems to be like this push for like hormones just in general. Is there any evidence behind that? Like what actually does the science show with regards to testosterone and men's health?
Yeah, I mean, it's big because testosterone is that main male hormone that makes men feel like men. It is what gives us our energy, our drive, our sex drive. It helps power our erections, helps with our confidence, our mood, our brain function, the way we think and process. So it does a lot. It builds muscle, helps you lose body fat. So when that starts to go down and some men can start to see it as early in their 30s. I've actually had a few men in their 20s with low T, but usually in your 40s, 50s and beyond, that's when you start to see a noticeable decline and some symptoms to determine if you need to get checked for low testosterone. Number one, if you just lack energy, if you lack concentration, you're having brain fog, you can't really process things like you once did, you're moody, you got mood swings, you kind of have a low mood, you're having erectile dysfunction, your sex drive is low, you're just not interested like you used to be. You go to the gym and you try to work it out and you're just not seeing results. Those could all be signs of low testosterone. So really no one knows, to answer your question, no one knows the exact number that is considered normal. And that's why there's a range of normal, right? From 300 to some say 1100 or so. That's a big range.
It's a big range.
And the reason is that everyone is different. Everyone metabolizes differently. Everyone has different needs. And so, I've had guys that were as low as 300 that felt fine, didn't, need anything.
Okay.
And you got some guys that, they're at 400 and they're just like, I'm dragging, I just don't have it. And so the way that I approach men is, we check labs. It's good to check before 10 o'clock, check in the morning, because there's a normal circadian rhythm to testosterone. So in fact, this is a little health hack I like to give men, but sleep, getting good sleep, because men don't prioritize sleep like they should. We're up late working or whatever, right. Really robbing yourself of building testosterone overnight, because that's when you're in REM sleep and deep sleep, that's when your body actually starts building testosterone and replenishing what you lost the day before. And so that's usually manifested. So one way to know if your T is low is if you're not waking up with morning wood, as we call it. Mm-hmm. That could be a sign of low T, or that you just didn't get good enough sleep. But that's the reason why we check it in the morning, because if you're low in the morning, you're low all the time. Right. And so, typically there are shots that we can give. That's the quickest way to boost the T, the T levels. We usually give a shot and then, give a couple shots and then check it like a week after your second one to see kind of what your peak levels are, and then correlate with that with how you're feeling. I just don't go by the numbers. So if, you're at 300 and we get you up to 500 and you're still not feeling it, then we'll titrate it up and, crank it up. We still want to stay within the normal physiologic range, but there's a lot of wiggle room in there. So we just do it based on your numbers and how you feel, basically.
Okay, gotcha. So when do they usually start to notice a difference? After one shot, or is it usually like take 3 or something like that?
It depends on how low, but I think the lower you are, the quicker you notice a difference. So you can notice as soon as 72 hours after a shot and start to see the difference. Yeah.
At what age would you say men should get their testosterone level checked or start getting it checked?
I would just say if they, that's not a typical screening test. It's one that usually you have symptoms for. Yeah.
Symptoms, and so like what you mentioned.
Any of those low T-like symptoms, you're just not feeling yourself. You just don't have the mojo. You're just out of sorts. Go get it checked and see what it shows. Get a free and a total testosterone. Mm-hmm. The free is important because that's the active testosterone that your body has to activate receptors and that you feel. There's some testosterone that's bound to protein that's not free. And so what the total tells us is the free and the bound, and they give you the total. But if you're looking at your free testosterone, if that's low, but your total testosterone is normal, then physiologically you're still low because the available testosterone is low.
Okay, that's good to know. Yeah, so they need to have both checked together.
Yeah, both checked. And really, so I've had patients of other physicians that will tell their patients, oh, your total testosterone's in a normal range. You should be okay. Mm-hmm. But their free is low and they won't treat them. And so if that's the case, I would get a second opinion.
Yeah. Especially if they're symptomatic. I'm assuming that these individuals are symptomatic. Yeah.
They're symptomatic. Now, there's various ways to treat testosterone with shots, with gels, with depot pellets that you can insert that release testosterone over time. There's nasal preparations. There are pills that are not
really? I didn't know there was nasal. I knew about the shot, the IM injections.
Yep. Yep. Those are most common, but yeah, there's a nasal preparation, but it's very labor intensive. You gotta squirt in
Okay.
both nostrils like 3 times a day, and I don't think anybody
Oh,
really
that's a
has
lot.
time to do all that.
Yeah.
So that's less popular. But there are. So here's one thing that your listeners or their significant others should know, that if you are still wanting to maintain your fertility, then you should not get on testosterone replacement therapy because it can make you infertile.
Oh, really? That's interesting.
Yes, yes. And it's about the feedback loop between the pituitary and your testicles, where your hypothalamus, when you're getting exogenous testosterone, then your brain thinks we're good. We don't have to send signals to your testicles to make testosterone. So it shuts down production of testosterone. And what else do the testicles do? They create sperm. They produce sperm. So it lowers both of those. And so men who are trying to conceive, I always ask if they are, of a certain age, I always ask if they have fertility concerns or want to have kids. And if the answer is yes, then I never give them straight testosterone. I recommend an aromatase inhibitor, anastrozole, to block the conversion of testosterone to estrogen, which can happen. So aromatase is an enzyme that's found in adipose or fat tissue that converts testosterone to estrogen. So by blocking that enzyme, you can indirectly raise the T levels and hopefully also raise the sperm count. The other drug that we use is Clomid, or clomiphene citrate, which is a drug used for infertility in women, right?
Yeah.
So it stimulates the gonad, just like it stimulates women to ovulate. It stimulates our gonads to produce more sperm. And so that's another way you can raise T and raise the sperm count and not compromise fertility.
Man, this is so interesting. I feel like I'm learning so much. I was just thinking of this. It was like this couple on social media. This is very random, but he's like going to the doctor and the wife is like, I have all the questions. I know what I'm going to ask the doctor. You don't even need to be there. And it was like this running joke of how like women or wives or whatnot sometimes take over the man's health situation.
Yeah.
And sometimes the man is like, I'm good. So I want to switch and say we talked about prostate health, testosterone, and I want to talk about the most important thing that most men become very concerned about, and it's a big deal because it affects us too, their wives, the people that are married and dating, whatever, erectile dysfunction. And I found that when I was doing primary care, obviously I saw that you don't see that in hospital medicine, but in primary care, I noticed that people don't often realize what it's due to. Like they will come in wanting a pill, right? Viagra or whatnot, but didn't really realize that it's connected to cardiovascular issues and that it's actually very concerning, not just because of what you're not able to do in the bedroom, but like your overall health. So can you touch on erectile dysfunction? I guess, what is it? I guess what causes it? And yeah, that's a good place to start.
So erectile dysfunction is defined as the difficulty to achieve and maintain an erection sufficient for intercourse. That's the official definition. So if you can achieve it, but you can't maintain it, that's ED. Not to be confused with premature ejaculation, which is another issue that men struggle with, but it's not related. And so there are several causes of erectile dysfunction that a lot of people don't realize. And like you mentioned before, cardiovascular causes. If you think about it, it's all plumbing, right? It's all blood flow. And if you are having poor blood flow in one area of your body, you're probably going to have it in another, right? So things like high blood pressure, things like diabetes, high cholesterol, these are all factors, obesity, sedentary lifestyle. These are all factors that lead to clogged arteries and a decrease in blood flow. And some, studies show, or, it's widely known that, the erectile dysfunction can be the canary in the coal mine. It could be telling you that you have some underlying cardiovascular issues if you have ED. There are also hormonal factors for ED. So we talked about that with if your testosterone is low, then you're less likely to be able to achieve an erection. And in fact, if it's low and you're just given a pill, you may not even respond well to it if your testosterone's in the tank. Testosterone's kind of like it sets the table. Sets the table for healthy sexual function. And so we want that. I often start with that. If someone comes to my office with ED, I'm asking, I'm getting their T levels checked to see if there's something we can correct, because sometimes that's all you need to tweak in order for if it's hormonal. There are psychogenic causes of erectile dysfunction. So if you have depression, if you have anxiety, if you've had some trauma, sexual trauma, cognitive dissonance, there's many things that can psych you out of a good erection. And so that's really a big one. A lot of people don't talk about the mental aspect of erectile function. And then there's sometimes there's surgical issues. If you've had prostate cancer, you've had treatment for prostate cancer, you can develop erectile dysfunction from that, or radiation even, you can develop it from that, or some pelvic injury. Those are all things. If you've got bad diabetes, there are neurologic causes, the nerves that power the erection just are damaged. So there are many causes. A lot of times it's multifactorial, but there are things that you can do with lifestyle that can help mitigate these underlying causes of erectile dysfunction. And really, that's kind of what I've been focusing my entrepreneurial pursuits on, is really looking at what are ways that we can prevent or reverse these underlying causes through diet and lifestyle and with supplements. And that's one of the reasons I came up with my supplement, Naturally Man.
Yeah, so I love talking about lifestyle and prevention, and treating things naturally too. Supplements, I'm big on supplements, diet. So let's talk about that. Dietary practices that men can institute to reduce the risk of erectile dysfunction.
So I'm going to say this, and I think most of your audience will receive it well. Because studies show that people who are on a plant-based diet have less incidence of erectile dysfunction than people that eat meat.
They'll receive that well. If there's women listening who's plant-based and their husband's not, they're going to go and tell them that now. They're going to be like, did you know?
Yeah. And it actually is crazy. Like they've done studies to look at the degree of plant-based versus strictly carnivorous, and they put it in the quintiles. And the further you go towards a more plant-based diet, the better your erections are. So,
yes, I have heard that and read that before. They actually highlighted that in a plant-based movie recently. I think it was Game Changers. They were talking about that. There was some studies.
So that's good. There are certain foods that can power your erections, right? And these are beets. Beets are like one of my favorite. It's a superfood. It does so much. It not only is full of nitric oxide precursors, but it helps with athletic performance. It helps with brain fog. It's a liver detox. It just does so many things. So beets, that's like number one. Another source of nitric oxide is found in leafy greens and dark leafy greens like spinach and kale.
Oh, I love this.
Turnips. And so, that's why Popeye was on his spinach, man.
Yes.
After that,
yes.
He got swole, right? After that. You didn't know that's what they were talking about.
I did not know that's what they were talking about.
Yeah, he got all swole after
this.
That's
hilarious.
It gave him his power. So, so no, there's some truth to that. And the crazy thing about it is that your mouth. So this is how this is all kind of tied in. So even oral care, keeping your mouth healthy and keeping a healthy microbiome in your mouth actually helps with your erections. They've done studies that show that gum disease is linked to more ED. And the reason why is because the conversion of these nitrates and nitrites that you consume in your diet, the conversion to nitric oxide, which is the gas that leads to vasodilation, it's done in the mouth.
Wow.
With the enzymes in the mouth, right?
That's so fascinating.
Isn't that crazy?
Yeah.
So actually flossing.
Dental health is even important in this.
Oral health is important. It all kind of works together, right? And so beets and kale and all the leafy greens, my big thing, watermelon and nuts. These things are rich in cantaloupe. The melons have
Oh, the
citrulline in them.
melons.
Oh, yes. Oh,
Okay, okay.
yes. I put all of
I
this.
feel like people are writing this down as a list. Beets, kale, melons.
This is your grocery list,
That's
ladies.
your grocery list.
There was a study that showed that men who ate a handful of pistachios for like, I think it was 14 weeks had an improvement in their erectile dysfunction. And so the idea behind this is that, you want to eat, you want to cook intentionally. If this is an issue, a concern for this end, you can't just do it once. And, these have to be staples in your diet in order to get the full benefit. And the, berry, blueberries, strawberries, cherries, they're rich in bioflavonoids that are powerful antioxidants that combat all sorts of disease, but they improve erectile dysfunction. They slow down the aging process. They help with cardiovascular disease. They help prevent cancer. So berries are great to add to the grocery list as well. So I really am big on, these natural foods. Even dark chocolate has properties. If you're going to eat chocolate, eat dark chocolate because it has properties that can help improve your erections. And so many of now I realize it's hard for men to do this every day unless you have, someone that's really watching it and doing it. But even when you go to work, it's hard to get all the good stuff in you every day. And that's exactly why I created this Naturally Man, because everything that I mentioned, the citrulline and arginine and beets and kale, it's in here. And so it is comprehensive meal. So it's not just for erections, it's for overall health and well-being. But yeah, so I realize our limitations. It's difficult to do that, but that's why I'm a big proponent for supplements.
Yeah, I'm a big proponent of supplements too. Eating fruits and vegetables, eating them as much as possible, but then also supplements because you can get a higher dose of it. Like I like, when you're talking about food, garlic and ginger, I like to use this as like anti-inflammatory, ginger for gut and digestion. So what are so you talked about some of the foods that can be helpful. What are some of the supplements? I know that you have a supplement where everything's kind of together, but you mentioned it when we were talking previously about ashwagandha, and then there was another one.
Yeah. So a lot of men, you talk about getting older. A lot of men are on supplements for their prostate health. And so saw palmetto is a really big.
Okay. I've heard of that one. Yeah.
A huge supplement for men in their prostate health. I've included that in Naturally Man. Saw palmetto is actually good for women too, for their skin. Pumpkin seed and flaxseed are also good supplements for prostate health. It helps reduce congestion and inflammation, which is also in here, little plug. And so those are all of the good things that you can do. But there's some things like trace minerals like boron and selenium that are a little bit more difficult to source that can actually help improve testosterone levels, right? Naturally. And the way that works is boron actually uncouples testosterone from sex hormone binding globulin, which is that protein that bounds it up, that keeps it from being free to be active. So when you uncouple those, you actually raise your testosterone levels, right? So that's in the supplement. Also, selenium, which helps support Leydig cell function, which are the specialized cells in the testicles that produce sperm. And so that helps with sperm production, fertility, all that stuff. So maca root is really good.
I like maca root.
Yes. Korean ginseng is also good for sexual health. Again, all of these things that are in here. So yeah, there are a lot of things you can do to boost, but the main thing is, eating colorful menu of food, right? The reds, the purples, yellows, oranges, just try to vary your diet. Eat as much whole foods as you can. Eat as naturally as you can. Food, don't over process foods. My goodness, don't fry foods. Get an air fryer if you want that crisp. But yeah, frying food, you fry a vegetable, it's not a vegetable anymore. I'm sorry.
Exactly.
People think they're eating healthy because it's vegetarian and it's fried.
And tell people it all starts with our plates, right? That's like the foundation of good health, what we eat. And then everything else, to me, are the building blocks on top of that, like exercise and sleep. Like don't eat junk food all the time and then be like, let me take apple cider vinegar. Let me take this detox tea. Let me do this supplement. No, it doesn't work like that.
Yeah. I agree. Like I would never tell somebody just take this and sit on the couch or don't exercise or, because you're really not helping. It all works together, right? You got to have a good cardiovascular system to circulate all that stuff in your body anyway, right?
Yeah.
So exercise is another lifestyle hack that can help with cardiovascular health, but also, it helps overall with your mental health, and actually movement helps with certain parts of your brain. Helps with your prefrontal cortex function, so your executive function when you exercise. But it is, when you do weight work, it helps build testosterone. Your body, your muscles release testosterone into your system. So weight work is good. Don't just do cardio. Don't just spend all your time on the treadmill. Put some weights. And women do it. My wife does weights every day, and
she's good.
She's not looking like
forget. I'd rather do cardio any day.
Yeah. No, and it's something that you don't, but as far as like toning, burning fat, muscle burns fat. You just get more metabolism the more muscle you have. And so that's important.
Yeah, that is so good. And what about mental health, like reducing stress and spiritual practices? Sometimes that's something that's overlooked too, especially in the healthcare space.
Yeah. Well, I think mental health is so important in so many ways, but I feel like, and I've said this before, that I feel like every Black man needs a therapist.
Yes, I feel like everybody needs a therapist, but yes.
But I think the things that we go through as Black men and how we're targeted in our society and how we're looked at and the stereotypes, and everybody's just afraid of the Black man, that's traumatic. It's traumatic. Racism is real. It plays on our psyche, but it also makes our DNA weak. It predisposes us to diseases the more stress that we have and we carry. So therapy, talking with someone on a regular basis is great for your mentals, but also self-care, doing things that you don't have to perform. As men, we're always feeling like we got to do something and perform and achieve, but just doing something for yourself, get a massage. I'm a big fan of a pedicure. I'll get one maybe once every month or every other month. But
I had one yesterday.
Yeah, guys need to understand.
It felt great. I just wanted to relax, and I was like, let me go book a pedicure.
Yeah. Y'all know what it is, but men, we don't. And I think the stigma behind that is less now. But I know guys that get manicures and, just take care of themselves. And there's nothing wrong with that. There's nothing wrong with, spending time. There's a study. A massage is great, but just socializing with other men is good for your mental health. There was a study in Oxford that showed that men who went out a couple of times during the week had stronger immune systems and recovered faster from diseases and were generally, less depressed when they had guy time, So, that's important for us to be able to, because isolation, that's what's killing us. Isolation and depression, that's a cause for suicide. So that is good for our mental health, is being in community with other men.
Yeah, but also, that's so good.
Understanding, trauma that you've experienced and really processing that and dealing with that, because it does affect your relationships, does affect your psyche. So we all have this thought life, we all have thoughts and self-talk, and all you're telling yourself is negative stuff. Your body's going to respond in that way, particularly when it comes to performance anxiety in the bed, which we don't have time to get into, but that's huge. And then finally, the spiritual component is also important. I would say that's foundational, actually. Just being spiritually grounded and in alignment with God and what His purpose is for your life, because we get so distracted, so many things, and we're just not anchored and grounded. But having that personal relationship with God and spending time with Him regularly, can bring us back and center us, which is important, and particularly when it comes to intimacy, because we serve an intimate God. He wants to be with us. He wants to be in us. He wants to know us, and a lot of men struggle with intimacy, and I believe the vertical, is parallels the horizontal in that regard. And so
that's deep. You got deep. That is so good, though.
Yeah,
and so true.
It's all connected. connected. And so if you're not really grounded in who you are and understand yourself, it's really difficult for your partner to understand you or know who you are if you don't have a good sense of that. So, doing that hard work, that deep work is important. So you mentioned this earlier, but I have a coaching program called the Woodsman Group where we basically go over each of those components for men. And I have a team of coaches, including Joey Kibble is one of my coaches. Dr. Wesley Knight is one of my coaches. Chef Brian in Florida, he's a nutritional coach and chef who comes up with meal plans for the guys. I have Neil Davis, who's a fitness instructor who comes up with exercise plans. And so we just try to address the total man in his sexual health and intimacy life and trying to get that all the way healthy.
Oh, that's awesome. How many, is this like a small group or is it like a larger group?
No. So I usually do it's like a 5-day challenge. I call it the Heart of Wood Challenge. It gets guys' attention. And then from that, we make the offer. It's usually a smaller group, and I like it that way because, again, it's a very sensitive topic, and it's not one that is easy for us to talk about. But if we can build an environment and a safe space of just, a few men that are all aiming for the same thing, and all the coaches are rooting for you and really, wanting to help, then I think you get better results than if you're in some big group. So it's small by design, meant to be
That's
small.
good. Yeah, I think the group component is really good and very beneficial. There are a lot of group programs for women, but I don't see as much for men. But I've started to see more now, some spiritual ones, some health ones. So I love the idea of a group program. And, like you mentioned about intimacy, I think this is cultural and just gender expectations. Men generally don't like to share when they're having a problem because I think it makes them feel like they're less of a man or like they're weak, right? So the idea of going to a therapist is repulsive to some men. The idea of going to the doctor is like, I don't want to do that. I don't need to do that. I'm fine. I'm strong. I can handle it. I can deal with it myself. So having these conversations to normalize going to the doctor when you have a problem. It doesn't mean that you're less of a man, when you have symptoms, and going to a therapist. We talk about marriage and family counseling. People go to premarital counseling. People will get counseling for their marriage with their wife, husband and wife. But the idea of individual therapy is less popular, I would say, especially in the Black Christian community. It still is kind of like, are you trying to say I'm crazy? I don't think I need therapy. And so I just want to put a plug for therapy as someone who used to think therapy was whack. I'm not even going to lie. I was like, I don't need to sit on no chair and just talk to somebody. But in 2021, I started therapy. I was very stressed during the pandemic, working in the hospital. I was starting to go through midlife, so perimenopause and whatever. So it probably was hormone or whatever. And I have been in therapy since, and it has been so beneficial. I was like, how have I come this far in life? I must be super resilient without a therapist. I don't know. But I'm like, they could have made the journey smoother, because what I find, like you mentioned about your thoughts, you think your thoughts are the right way to think. You know what I'm saying? Like whatever your thought is, it doesn't matter. But when you speak to someone who's objective and who's clinical, like a therapist, they can actually help you to see that the thoughts that you have about your interaction with that person or the conversation with your wife, your perception of it is actually based upon your past experiences, your beliefs, and it may not actually be accurate. You know what I mean? And I think that probably comes to play in marriages a lot, where you have an argument, you have a perception, they have a perception, you think your perception is right, but neither one is necessarily right. So it's just interesting to me.
It is. And that is something that, for couples that are going like counseling, I actually have a therapy appointment tomorrow.
Awesome.
And did a couples one with my wife today. She does it as well. And so I think when you think, it's not a sign of weakness, it's actually a sign of strength, knowing that, you are trying to organize your thoughts. You're trying to be the best version of yourself. And, you wouldn't, if your car was knocking, you wouldn't ignore it, and just
you take it to the mechanic.
So why do we treat our cars better than we treat ourselves, our bodies, our minds, we really want to be in tune. But I want to go back to one of the things you said about this erectile dysfunction being a problem that men don't discuss. We don't discuss it with our wives. And here's the thing, like they already know. It's not like it's a secret, that you're struggling in that department. And what will happen is that because the only way that we feel like we can perform as a man is if there is penetrative sex, and anything short of that is not sex and it's not intimacy, then, we avoid it altogether. And so the problem is there's a vacuum, right? There's this space that no one's talking, and it has to get filled with something. And so she's thinking, oh, it's me. He doesn't find me attractive anymore, or maybe he's got something else going on, and that's not the case because he's just not talking about it, and he's like, I'm feeling less than a man, and, I could do something, but I don't want to even start because I don't want to let you down, and I don't want embarrassment, so he's not going there, and so there's this divide that, one of the things that I hope comes from this is to normalize the conversation about sex and our struggles and our challenges. It's way too important in our lives not to try to get it right and not to talk about it. And there are ways that women can help men. Really, because when we think it's all about a performance, we think a certain way. But if our partner, our wife is like, no, like relax, this is about, pleasure and, being close and, feeling good with each other, you take that pressure off of, I got to do it this
performance.
Way. Right. Yeah. Of performance. And even that can help with performance when you take the pressure off and thinking, hey, this doesn't always have to lead to this. Right.
That's so good. I was just thinking too that this is my view, my personal view. I think Satan does a really good job of pressuring people before marriage. I believe in sex after marriage, right? According to the Bible, right? That's my view. And I think Satan does a good job of before marriage pressuring people to engage in sex. But it seems like once they get married, there's studies that show the longer they've been married, couples have less sex as time goes on, and particularly once they have children. And from my conversations with my friends and whatnot, I'm in my 40s, it seems like it's not as much of a priority for women compared to the men. So while I have you on this platform, I wanted to have you speak to that, because I think that sometimes women may not see things from a man's point of view. Like, we want you to say you love us, buy us flowers, right? But then I feel like this is a generalization. And you can correct me, but I feel like women be like, well, I'm tired. I'm taking care of the kids. I work, and he wants me to be having sex like once a week or twice a week or whatever. I just feel like they make it seem like it's not important. So can you speak to the women who feel that way and touch on how important it is for men?
Well, I will say this, that is one way that we receive love and we receive intimacy is, when the act of being received, being accepted, being wanted, like these are human needs that we oftentimes express sexually because that's the only way we know how. So that's kind of the only language we speak in some ways. And so, some ways there has to be some education for us as men. That's not the only language. If men knew that, vaginal penetration is like the least favorite form of sexual pleasure women have, they may think twice about, that being a priority, but it's our number one. So there's a disconnect there. But I think that there's education to be had on both sides. It's very important for men for our sense of self-worth, our self-esteem. We get beat out in the world. We want to come home. We want to be received. That's just kind of, how we're wired, but we can compartmentalize, I think, better than women, right? We can, we could have lost our job, but if you standing there naked with,
right.
towel on,
it's all good.
I'm gonna be able to compartmentalize.
It makes up for it.
What'd you say?
It makes up for it.
Right. You can separate it, but women, a lot of things run together. So,
Yeah.
they had a bad day at work, the kids are acting up,
Don't even bother.
it's like they're not even in a headspace.
Yeah. They're like, how could you even think about that?
Why would you even consider
What
that?
is wrong with you?
We're thinking, are we
What
alive?
is wrong with
like,
you?
why can't we do it? So I don't think there's a right or wrong. I think there are truths on both ends, but I think having the conversation that, hey, this is important to me, but also this is what warms me up, because women don't have spontaneous desire like men do. And that's another important factor.
Yeah, they need time to be warmed up.
They have receptive desire, but it's responsive desire, but it's not spontaneous. And so, there are things, and oftentimes if you're listening, you can kind of get clued in on what it is that if your wife, she's telling you, hey, when we're out in public, show affection. We just want you to show affection when we're in the bed. Or I don't want the first time we talk is when you come home, like send me some text or, have
something during the day.
Pregame,
something.
Show me that you have some interest, outside of just the bedroom, or taking the load off of her, taking care of the
kid, that helps.
Giving her a day, cooking, doing something so that she can be free, because when this is on her head, she's not thinking about it. So, but we have to be careful in that our motivation is not transactional. Like we're just doing the dishes because we want.
Good. Yeah, that's so good. And then also initiating. Women can initiate. I've heard of women who've been married for years be like, they don't initiate, or their husband wishes they would initiate sex more.
And
there was actually somebody posted about that recently on social media. It was like a whole conversation about that. I can't remember who it was. That's probably a whole another conversation.
It is. But I think it goes to the point where men, just like women want to feel desired, I think men want to feel wanted and desired too. And, if you're one that's always knocking on the door and, you get rejected sometimes you don't, like after a while, it's like, shucks, like, what am I? So, but again, those are conversations to have because, there may be clues that she's giving you, just not picking up on it because you're not paying attention, so there's some nonverbal cues as well that women can give.
So we can learn on both sides, but this was such a good conversation. We're going to put the link for the supplement. You can hook it up again.
Yes. It's Naturally Man.
Naturally Man. Yes. There you go. It's on your website. We'll have the links for that below. This was so good. We touched on so much. I feel like I need to have you back at another time. We talked about nutrition, prostate, erectile dysfunction, testosterone. I know this is going to be so helpful for my viewers. So thank you so much for joining. And you can actually share the website now and your Instagram too. So
it's you can buy Naturally Man at www.man.com. And I go by Ask Dr. QMD on all social media. So Ask Dr. Q, no period, MD on IG, TikTok, YouTube. Yeah, all of them.
Perfect. And that's where I found you on Instagram. You post some really good content. I love the work that you are doing. Like I say, I was so excited to find a Black urologist, and then you were Christian too. I was like, hey, this is a win. So thank you so much for your time today. I really, really enjoyed it. I learned a lot myself as well. And thank you so much.
Good. Yeah, thank you for having me. Appreciate it.
All right. Thank you everyone for watching, and I'll see you in the next episode. Bye.